David, your blog, What Your Doctor Isn't Telling You, on our website is actually one of the most successful blogs that we have thus far. So which, testament to you, but I think also testament to this topic that people just are so hungry to know what's going on and to get the information that they need. So what is it that inspired you to write this type of topic and this type of information?
Well, I think first of all, I've been exposed to medicine and healthcare for like 50 years, both as a child of a physician. I used to go on rounds with my dad. He practiced medicine for almost 6 decades. So as a teenager, I would go on rounds with him and see hospital patients and meet a lot of his patients in his practice and get exposure that way. And then I also had a sibling who was quite ill with a chronic disease, and I saw the things she went through when she had to go in and out of the hospital and have certain treatments. So the combination of being in a medical family and having someone in the family having to use the healthcare system so much led me to have kind of this passion about helping people navigate the system, which is often so complicated and becoming even more complicated.
And for the doctors as well as the patients.
Yes, because doctors too are frustrated because there's so many regulatory and government issues and business issues that are affecting doctors that they're getting pressure too. So it's not a good situation where the people who are supposed to be taking care of you are under the gun as well. I thought that it's necessary to bring some things to light that perhaps just get kind of swept under the carpet.
So what kind of things have you seen change in your 30, 40 years of practice?
Right.
From the time you started till now in terms of
right.
frustrations, what doctors can and can't do for you,
right.
et cetera?
Well, I think there have been some really good things and there have been some really bad things. Maybe we should talk about the good things.
I'm all for good.
Okay, so I think the ability to communicate across the broad spectrum of specialists so that you have an electronic medical record can tell the radiologist in 2 seconds, give the report to your internist on the computer system so that he doesn't have to call the radiology department, track down the radiologist and say, did you get the chest film on Mrs. Jones? So I think the interconnectivity technology's done a lot to improve medical care. I think the treatments themselves are just off the charts, stem cell therapy, gene therapy, diagnostic tests that we never had in the 60s and 70s, like CAT scans, MRIs. I mean, this is changing people's lives and curing things that we weren't able to cure before. So I think in those ways, it's really good. I think the ways it's bad is you've kind of taken away the personal nature of medicine, your family doctor kind of thing, who knows you and knows your family. It still exists, but I don't think it exists to the same extent. So once you're part of a health system, I'm not sure you get to know your doctor as well as it was in the old days.
Well, and I think also that, they talk about the science of medicine, but it really is an art.
Right.
So that having that relationship is important, and having the report and having the doctor know me as a human versus breaking me down into merely a series of lab tests makes it in some ways more difficult for you to treat me as a whole. Right.
Exactly. Well, the electronic medical record, like I said, it has a tremendous pro side to it, but there's also a con, because I don't know if your doctor uses one, but when I visit my physician, she's both talking to me but typing at the same time.
Oh, they're sitting like this on the left.
So they're typing and they're talking, so they have to input their information while dealing with you. Now, my doctor, I know, cares for me and does a great job and really does communicate well, but I've been to some specialists who are busy clacking away, just busy recording what you're saying instead of kind of looking you in the eye and understanding what your problem is.
It seems like medical schools and the medical practice is starting to hear a little bit more about the humanities in medicine.
Yes, and I'm glad you brought that up, because I read a recent study where we're really short on primary care people in this country. I think that only 1 in 5 doctors in medical school now will go out and 1 in 4 or 1 in 5 will go out and do primary care. And a lot of the underserved areas, the rural areas of the country and part of the inner city, they're not getting much care at all. So they are teaching people to be more into the art of medicine, to be more empathetic, to know how to ask the right questions, to not interrupt patients, to elicit better information, and to become more complete doctors than just, say, technicians.
Well, and I think somewhere with the increased awareness of that, I think somewhere with the increased pressure on the healthcare costs,
Right.
and I think somewhere with help from you and your writings and the books that you've written to help people learn to advocate for themselves and ask the right questions and bring back the communication.
Right.
Yeah, drugs, surgery, there's so much technology that's done great,
Yeah.
but in the end, it's communication.
Right. And you know, I just was going to
Right.
make a pun, but it's not a pun. That's the
Right.
bottom line. You have to take care of it yourself. And, you know, you really can't expect the government or other people to solve your health problem. They can certainly help you along the way, but there's so much you can do yourself to make sure you never even have to deal with this system. I mean, simple things like losing weight and eating better and exercising. I think that 80% of chronic disease is due to poor habits. And so, you know,
Self-imposed.
right,
Right.
exactly.
All right, well, thank you very much for being here, David. We're thrilled to have you part of the Bottom Line family of experts.
Great.
And that we've got this doctor telling us what their doctors aren't telling them.
Exactly.
So, well, thank you so much.
Thank you.
If you like what you just saw, do me a favor, share it. The healthcare challenge is really a problem for all of us. And the more we can get this information out and get people taking better care of their health, the healthier we will all be. We have more videos with Dr. Sherer as well as his blog, What Your Doctor Isn't Telling You, at our website, bottomlineinc.com.